list, I realized that research was a much bigger part of my career interest than I maybe thought initially. And yes, that's in spite of having the PhD, but that was not an expected pathway for me. And so my list really valued that aspect of training, and it didn't have to necessarily be through specific physician scientist tracks, but at least did they have experience in working with residents who came in with different research backgrounds, and what sort of support was there. And the other piece that was also interesting to me, because I was thinking about fellowship and knowing that I didn't necessarily want to move my family multiple times over a short period of time, did they have the potential for fellowship interests that I had at that time? And from peds, it was either emergency medicine or critical care. So I kind of weighed those pieces in, knowing that there were a lot of components of the training programs that were going to be equal between them. You know, everyone was going to talk about the tracks and how they utilize their curriculum, the exposures to different patient populations. That mattered to me, but I also was able to just kind of weigh those pieces differently as I interviewed at places and put it all together at the end.
Great. So for me, I first would say, I think you hear Dr. Trevino mention priorities, which is geography and family considerations. I think all of you, when you're considering your application list or your residency program list, is what are your priorities? A few, as he mentioned, geography. Some other considerations I had was the size of the program. Did I want to go to a small, medium, or large size program? It's usually divided up like 0 to 10. 11 to 30, 30 and above. If there's questions, we can get into nuances about size, but what size program? Is it at an academic institution versus a community program? Is it an independent children's hospital versus a hospital within a hospital? What is the, diversity and inclusion composition of the program and faculty? Do they have certain tracks? Do they have like a community track, an urban track? Et cetera. So I think you need to know first, like, what are your priorities in a program? Do you really want to be in a big city because you want a social component in addition to tough residency training? Do you want to make sure you're best prepared for fellowship? So I think once you have your priorities, then I think certain programs are going to fall off your list and then certain are going to rise to the top. For me, geography was pretty important for 2 factors. One, I wanted to be close to my family. I'll say 3 factors. One, I wanted to be closer to my family. 2, I had already established a network of pediatricians, primarily in the American Academy of Pediatrics and also in the National Medical Association. So I wanted to be in some geographical adjacent program to those networks. And then also I knew I wanted to be in or at least near a large city. So truthfully what I did, so Dr. Freeman mentioned Frida, I actually printed out the list of all active programs at the time. It was 142 and I went by state, because geography was really important. So I literally said, I do not want to be in this state, this state, this state, this state, this state, and just went down the list. And then I identified the states that I wanted to be in and then went through my priority. I knew that I wanted to be at an academic institution. And then by that, I actually was able to narrow it down to 30 programs. And then I got it down to my last 20. For me, I thought 20 was a good number. So again, you have to know your priorities. And then once you have that, programs will start to rise and fall as you go along.
I believe I'm.
Yeah, I can't remember.
Though to be honest, the 3 of us were about.
Yeah, we were all together, so.
But no. So I actually echo what the previous panelists have said in terms of family. So I knew deep down, though I'll be honest, you have to keep your options open. But because from birth to end of medical school, I never left the state. Part of my desire was to leave the state, but then not go too far from where I am. So, because family was that important to me. But because my family's large, I knew I could span a little because I wanted to try to find a place where I knew family wasn't far. So that was a big priority to me. I would also echo the size of the program. At that time, I did not know I wanted to specialize. So I wanted to make sure I was able to see and be a part of a place where if I really wanted to pursue primary care pediatrics, I knew I would be able to have that clinical understanding. But at the same time, if I wanted to pursue a fellowship, I wanted to make sure I got a true flavor of whatever different fellowships there were. So being part of an academic size institution made sense to me. I'm not a research person, though I know I'm going into that area, but to be honest, at that time, I definitely wasn't. But I knew at that time, and just to give you guys a heads up, usually all pediatric residents have to pursue some type of scholarly activity or scholarly project. Did it make sense with what I wanted to do? At that time, I'm interested in music. I still am involved in a couple musical activities, but that's sort of unusual, right? Like, what place would be considered in music as it relates to pediatrics? But surprisingly, as you'll hear later in questions, a residency program answered that for me. And so that made sense to me. And so overall, I think when it comes to a program, and you'll hear this later, probably from the directors on this panel, you want to get a sense of bread and butter pediatrics and then get comfortable with zebras too. So I'll end there and let the other panelists finish.
Oh, me? Okay. So it's funny because unlike the other panelists that are speaking, as a program director, I see the tale of two cities. I see it on the full spectrum, right? So I see what I wanted when I was a resident and the thoughts that I thought about when I was a resident. And now that I'm a program director and I'm seeing what program directors think about our candidates, and especially what candidates may view as important, but when you look at the grand scheme of things at the end of what your career is going to be, how much it vastly differs, it's amazing. So let me give you a point example. So there were three things that I was concerned about. I am a triple minority when it comes to pediatrics. One, I'm a Black male. There's not too many Black males currently in most pediatric residency programs. Two, I'm a DO. So being Black, male, and a DO, triple minority, I knew that I wanted to see other Black male DOs or even other Black DOs, other Black folks, you name it. This is what I wanted. For location, agreed. I think location was definitely important. And I find that most people who are at least somewhat comfortable when they first come into the role of an intern, the first year resident, they usually will thrive if they're closer to their family, but with some distance away. So case in point, one of the things I had a tough decision being able to determine whether or not I wanted to go into residency back home in Detroit at Children's Hospital in Michigan, or whether I wanted to go to Nationwide. I had a scholarship to medical school, so that required that I would have to stay at Nationwide to satisfy that requirement for my scholarship. But it was the choice of being back home in Detroit, which I was like, oh my God, this is a huge thing. But I realized family don't always understand the dynamics when it comes to a residency. And it's like, okay, church service, or come over and help me with doing whatever activity. All of those things come into play when you're choosing a residency. But the things that I think are so valuable when you're thinking about choosing a residency, especially on a program director side, and I'll talk a little bit more about this later, is thinking about things such as program size. What are your goals for your career? All of those things, your program can definitely help you with what you choose. That program can help make or break your decisions. And I'll leave it at that for the time being.
All right, thank you. And Dr. Woods, I will apologize. I might have made that slide in clinic. I know you're a DO. I've only known you for like 15 years. So my apologies. like, I don't know. This is why you don't do stuff while you're in clinic. Anywho, for me, I'll just answer real briefly. I definitely considered family. However, I definitely grew up in a different way than a lot of people. My mom was a flight attendant for 30 years. So my definition of close is real different from most people. Where I was like, is there a major airport? That means my mother can get there. So when I applied, I was applying out of Texas, but I literally applied from the Northeast to California. No, actually to Seattle was the furthest part, and like did the crisscross. So I knew I was looking for large academic center that was going to give me not only bread and butter, but all of the zebras and everything in between. I had done research prior to, I had taken a year off when I was working with SNMA and done research at NIH. So was very much looking for all of those things and tried to bring it together to find a residency. And I think I think it fit in the end. Yeah, so we had a question in the panel or in the chat box. So I'll go ahead and ask that one to the panel too now, and then go back to ours. So Veronica has asked, she said she keeps being told, don't worry, you're applying to pediatrics, but would like to know what else she could be doing, research, etc., during the time prior to applying. So I'm thinking in terms of right now, there's a good amount of downtime that fourth year medical students may have. What else could you be doing with that time, or what did you do with that time? That's for our panel.
You know, right now, when you're thinking about applying and you're thinking about how to be able to improve your application, one of the common misconceptions about pediatrics is, well, there's always a pediatric spot. Everybody always matches into pediatrics. And it's not always the case. We have several people who didn't match into pediatrics for whatever reason. Now, it's not to say that we are talking about radiation oncology or something else where it's a more commonly difficult program to get into. But the thing is that you also want to go to a program that fits you and that you want to be as your first choice. Things that I would say that will help you, especially looking now as the trend for the Association of Pediatric Program Directors, which I sit in leadership on. One of the things that we're looking at right now is how to be able to make sure that we're looking at the whole person. And so we're taking away a lot of those things that have typically been more a systematic degradation or have been something that has been a little bit more harmful for applicants who are more diverse or underrepresented in medicine. So some of those things are we're looking at leadership. So SNMA, LMSA, AMSA, all of those things are so important. What community service you have done. Research is always important, but the thing is that if you're saying that you're doing research, I don't want somebody who just went into a lab or was given out a survey and really didn't understand or grasp the concept of what they were doing. A lot of times I would say if you can't produce scholarly work or be able to at least elaborate on the work that you were doing on that research, I typically wouldn't bring that research up as much. Versus hype up the things that you really have been doing. If you really have been doing those community service and those leadership activities, that's so helpful. That shows me you can handle the rigors of residency.
I would like to add to that and echo Dr. Winters. And, you know, as I was thinking back about what I did, of course, I can't compare it to now because of the time we're in. So in the time we're in, I think community service is really important. And of course, advocacy. I think now more than ever, if you can get involved wherever you are in your medical school community or city or local community, voter registration. I mean, this is the time more than ever, making sure our communities complete the census. I think that's big. That's major, and that lets us know you're in tune with the community and specifically in tune with our children. Therefore, it makes sense in the pediatrics realm in our field.
And to kind of echo one other piece, I think ultimately, whatever you choose to do, you want to make sure that it's being true to who you are in your application and not just trying to get something else in because you have a couple of extra months. So really, I think one piece that will help set you up for your future career is really thinking about the value of your time. And so, yes, like Dr. Winter said, pediatrics is not just everyone gets in and spots are available and free flowing everywhere. But you want to make sure you value yourself, value your time, value your interests to really help highlight that aspect, because that's going to be a piece that helps you in your future career when time is a little bit more valuable, or is not as readily available, rather, not necessarily more valuable.
And I think my colleagues answered the question very well, so I have nothing else to add.
Well, let's go on to the next one that is somewhat in a similar vein. So were there any particular activities that you did that helped you prepare for pediatric residency?
So I guess I will then start. It's an interesting question for those who are fourth years. I think to Dr. Trevino's point, so you have 2 months actually just under 2 months before programs are able to download your application. So I hope that you have all been involved in some activities from M1 to M3 during that time frame. If there are those who are, earlier on in their career and interested in pediatrics, we welcome you in that regard. So I would say things that helped me for peds residency. Honestly, peds is an interesting residency. Most people have made the analogy that your intern year is like a fast track of M3 and M4 because you don't get that much pediatrics in medical school, as you guys may have mentioned. So I think what really prepared me, I'll answer one from an application standpoint and then two from actually being in residency. So I think an application standpoint is really being engaged in activities that were of importance to me and how I wanted to practice medicine. So I was really engaged in SNMA because I had a penchant for, health equity, for pathway programs, pipeline programs, serving underserved communities. And I think that was very evident on my application. And so whether I was going to go into pediatrics, internal OBGYN, I knew that I wanted to serve underserved populations, minority groups, and that again showed with not just SNMA from a leadership standpoint, but my community service as well. As a fourth year, I know, Veronica, you asked the question about what you'd be doing in your time. We still had to do some electives. I know that you guys are in a virtual setting, and so I made sure that my electives were in pediatrics. So I did an outpatient pediatrics, I did a PICU rotation as well, just so I could start to get more pediatrics under my belt. Even after my application was submitted, I wanted to make sure that I was keeping up some of my clinical skills prior to going into residency. And then again, looking back in residency, I think what really helped me is making sure that I still had some of those electives and not really going on the, traditional M4 vacation post November, December, if you have that opportunity. So I think where you are today with your activities, just make sure that, again, to Dr. Trevino's point, you should be doing things that you enjoy. And clearly you have a desire to go into pediatrics, so I'm sure that there's some alignment in that regard.
And in regards to like scheduling, and thinking about electives and whatnot during your fourth year, I actually would argue do the stuff that you don't think you're going to get a chance to do in pediatrics. So if there's some sort of surgical rotation that you're like, this sounded really cool and people had good experiences, or something like anesthesia or procedure based, and you're like, that would be nice. I think finding things like that can be helpful. I think you're always going to be able to find something that threads from other specialties or other like clinical areas like dermatology, like Dr. Winters just said. But thinking about the stuff that you're not going to necessarily be able to do in residency, because this is really your last chance to do it, because you never know what sort of electives are going to be available for you in residency, and even how the program has elective time set up. So that's a big consideration, I think.
I absolutely agree with that. And I would definitely ask different programs, different areas, and within your medical school, what can be possible. Always have the mindset of anything is possible, even in a pandemic. I do remember I did an ENT rotation. I was like, why do ENT? But it actually makes perfect sense in a pediatric setup. So I'm glad I took that opportunity, and it was awesome. And it was an adult ENT, but he clearly had pediatric patients, so it worked out beautifully. And so it made perfect sense. And yeah, I'll echo everybody else and let the program director finish that out.
Well, the interesting thing is not only program director, but also, like I said, I'm the director for undergraduate pediatric education for our branch campus of Thomas Jefferson. One of the things that we are struggling with right now is trying to find intentional and purposeful experiences for you virtually. And that comes into a place of, case in point, PICU, for instance. Most of our COVID patients or PUI persons under investigation for COVID lie within the PICU. Most of the schools, your schools, have different rules set aside that as an institution, I have my own set of rules, but then I also have to abide by your institution rules, your school rules as well. And so that's one of the things that a lot of people get confused about. So when we may have it where, yeah, you can come into the PICU as long as you are not around the COVID patients, but your school may say, absolutely not. So then we have, whether it's over Zoom or Microsoft Teams rather now, where we will actually have you round with the team via Microsoft Teams. And so it's not the best, but then it still allows you that opportunity to be able to understand some of the clinical decision-making that goes along with some of our patient care, that allows you also to be able to get exposed to the team, to see how the team runs for our residency program. It gives you so many other alternatives and goals. And why I push for things like dermatology, I love ENT that you brought up, even neurology, things that you may not even think of or see. Orthopedics. One of the things as a general pediatrician I can tell you right now is, Lord knows how many times we have come across someone who has a sprain or a strain, and I need to realize whether or not this kid needs to get an x-ray, whether or not this kid needs to be further advanced along to go to the orthopedic surgeon or not. I see rashes, I would say at least a third of my day is nothing but rashes. And I unfortunately never took a dermatology rotation in residency or in med school, and I regret it to this day. It's one of the things I push for everybody, because there's a book called Zatelli that we use that I guarantee you, even to this day, and I've been out of practice, I've been out of residency for over 10 years now. Zatelli sit right by my desk. We have good conversations every day as I'm looking up to see what a specific rash is.
Yeah, I would echo everything. I think what I did a pediatric surgery sub-I, which was in pediatrics, but that time hanging out with the surgeons was invaluable in terms of learning wound care, learning surgical management in general. And while it's not what I do, it was great. And the surgeons actually let me do stuff because they knew I liked children, actually, unlike some of the other people. So with that, Dr. Winters, keep yourself off mute. The next question is going to be, for those of you, or for those of us who review applications, are there any pearls that you have for our applicants, or any things that you would encourage them definitely not to do?
Okay, so here's my 3 common rules for you. Number 1, proofread. Proofread, proofread, proofread. Because I cannot tell you how many times I've come across an application that the candidate is such a great candidate, but there are so many grammatical errors that I cannot overlook that. So that's the first thing. The second thing that I will tell you is, don't over exaggerate, but don't underestimate yourself as well. What do I mean by that is, again, the research. If you are to make me believe, not even research, community service, if you were to make me believe that you are doing all this great community service, but then later on, I look at your application to find that you said that you participated in a walk, but you literally went the morning of the walk and walked for an hour and put that on your application in such a prominent spot as if you had organized the entire walk. That's overestimating. But then also, if you say, for instance, was a regional director for Region 5, and you didn't, which I was for SNMA, and you didn't highlight that and say like, hey, I was a regional director, I was overseeing schools in 3 states. I sat on a board of a multi-million-dollar organization. If you don't highlight things like that, then we will never know all of the wonderful things that you did. The last piece is, when you are writing your personal statement, please, by all means, make sure that it's a story that is going to grasp or catch me and my attention within the first paragraph. And your first paragraph should be no longer than 4 sentences. And literally, if you can't grab me in those 4 sentences of that first paragraph, I'm going to the next one. I have right now, at this point in time, probably by the time we get September 15th, I will probably have October 7th now, about maybe 3,000 applications that I have to review for 12 spots. So I have to cut people out in some way, somehow. And it may be that you have not the best board scores, and I'm looking to see whether or not I want to bring you in. I always look at their personal statement. I can care less about everything else. I just want to see their personal statement, see what they say. You got the first 4 sentences to grab me. So those are the 3 pearls I would definitely say.
That's great. And I would add to that. So I agree, certain, there are definitely the program directors that have to review everything. When it comes to, I knew one year I definitely did interviews. I agree with Dr. Winters on proofreading, and not just proofreading and specifically your CV and your personal statement, but have another either faculty or someone senior you trust review it. Make sure it actually makes sense to them. Do they understand what you're trying to portray? And maybe not just your story, but it's your story, your true story of your experience. Because to be honest, numbers and tests and data, yeah, that's one thing. But when it comes to the interview, that means we've already looked past that. And that means I'm now asking about you. Who are you? Because actually, when we do review your whole application packet, we're going to remember certain things that stick out, and then we're going to ask you and follow up on it. I do it all the time. And so if you can't really answer that, then I'm trying to understand why you put it in there in the first place. Especially if you've held a leadership position, and then what did you really do? Definitely tell the truth. All of us sitting on this panel, or sitting or standing, we're all sitting virtually on this panel. We have done something of a certain standard. And I know those of you out there have done something on a standard where you need to lay that in there, lay it in there. But yes, make sure it's proofread and make sure someone else reviews it. Because simple grammatical errors, yeah, that's going to turn some people off.
Yeah, I will comment. I'll start with the ERAS experiences. I tend to get a lot of questions about that. It's interesting because having been on residency recruitment committee and then also medical school admissions committee, in a sense, evaluating my peers, not at the level of, a program director like Dr. Winters, feedback that faculty had given me, right, is making sure that we're identifying really robust or significant experiences. So to Dr. Winter's point, right, you don't want to estimate this, but I don't think you should also undersell yourself. I think actually students tend to undersell themselves, especially on really major experiences. But at the same time, you don't want it to be a CV filler. So I've actually recommended for students, you should have a working CV. If you don't, this is a great time to write a CV, but really write out all of your experiences and what you have done in medical school, and then really start to identify, what's significant, what's longitudinal. You really don't want to put I think all of us, right, have been involved in service in some capacity, but when you're getting into the 1-day service events, that's, now you have 10 experiences, but each of those were for 1 day, could you consider grouping those in terms of, community service outreach over, a 2-year period, and then you're listing what those were. So you don't want it to become a laundry list. You really want it to be a portfolio of what's important to you and what contributions you've made either in medical school, in the community, or within an organization. I think for the personal statement, the word is personal. The programs really want to get a sense of who you are, why you're interested in pediatrics. Some can be as standard as, I want to be a pediatrician because of this, and this is what I'm thinking about career term. Something could be a very significant experience that you had. I would tend to stay away from cliche stories. So things that are cliche is, we're all pediatricians, right? But I met a child that had cancer and that changed my life. And now I, want to go into pediatrics, and then if someone were to ask you that question and it's, you saw it on TV or you rotated and you met that patient for, 30 minutes on your rotate, it's not really significant to you. So again, make it personal. And I agree with having somebody read it, especially someone who's more senior, just because delivery of personal statements can be hit or miss. And as Dr. Winter says, I will generally read the first 4 or 5 sentences and decide if I'm going to keep reading. Right. So I'm going to make the decision if I'm going to keep reading or if I say, okay, standard statement, and you kind of put it to the side. So it looks like Dr. Winters wants to come back on that. So I'm going to turn that.
I'm so sorry to interrupt because I know Dr. Trujillo probably wants to speak, or Dr. Freeman. The one thing I was going to tell you as well, when Dr. Walton was talking about proofreading, and also this is the one thing that you can definitely do as well. Your MSPE, which comes from your medical school, you have the right to review that. And I would definitely say please review it. Please look and see. This is from your medical school. These are descriptions that are coming from your clerkship experiences. This is written by most likely one of your deans. You can look and see if there's any information that's in there that can be either negative against you, or it could be incomplete or incorrect. And one of the things I would say is, how will I know if something is not the most sincere? One of the key points is if somebody says, showed much improvement. Every time I see show much improvement, that's kind of an underhanded comment of saying like, this kid didn't really know anything at all and barely got to the point of knowing something now. So if you see that, I would definitely say, see if you can get it rewritten again.
I'll just add 2 things real quick. So 1 or 3 things, sorry. 1, my pet peeve, and I'll be honest with it, is in your personal statement, make it personal, but recognize that I know medical students are not running codes. And when you overstate your clinical experience of like, I changed this person's life, it makes me feel like the rest of it is like fluff. To the person I actually always say read a personal statement is your mom or your dad or someone who actually doesn't know medicine quite as well, just because it helps you tell if it's a coherent story, or like, and if it represents you. So someone like, we are famous for using abbreviations, which are good if it's really something that's universal. But like Colorado, they love this thing, MOC, which I'm guessing half of this room doesn't know what it means, which in Colorado, that means mother of child. Why can't you just say mom? But just thinking about those things. And then the last thing actually goes to Veronica's question, which I will share with you all in just a second. But the last thing is in terms of addressing things that may not be the most positive things in your application, a question of where to do this. So Veronica's question actually is, should I address a low step score or clinical grades during an interview, or only discuss it if I am directly asked about it? So I think that is I have a 2-part answer to that. 1, I would say use your mentor through this program. And I think if you signed up for mock interviews, that is something definitely in terms of strategizing your application that can be really important. I think it is something also to talk about with your medical school. If they allow you to give input to that MSPE, that might be a better place to have something like that addressed than your personal statement. The reason I say that is your personal statement is often shared with everyone you interview with. And our program, for instance, shares your personal statement and your letters of rec, and then your CV, but nothing else. So we don't share your grades. We don't share your step scores. So your interviewer can be biased by that information if it is in there, but they didn't necessarily have to have that information. So I think it's just a strategy in terms of figuring out where to put it. In terms of Veronica's questions, does anyone else have thoughts on that one? And then we also have a question from Jeffrey that I'll get to.
So I want to add to that, and I echo what she said. So I think what Dr. Freeman said, each program's different. So when an interview comes to me, I already have I don't have to sort of deal with your test scores or your step scores, because there's sort of a category like, all right, if you've made it to the interview level, that means they've already looked past or already acknowledged or already, dealt with that. So I didn't have to do that. Though I will say, and maybe the program directors can speak up, I think when you interview, whenever you're part of your interview day, you're going to interview other faculty, you'll probably meet some residents, and you'll interview, probably the program director or associate program director. In the case that comes up, maybe the one person I might want to bring it up to is probably the program director, the residency program director, if you want to have an honest conversation and be humble and truthful about it. Because with me or other faculty, we just want to get to know who you are, right? Because you're the one that's going to be on our rotations, on our rounds. So we want to get the real you. That's why your personal statement's going to be more important, and your letters of recommendation. That's going to be huge because we pay very close attention to those. But that would be what I would add to that. If you're really going to speak to someone and have that honest conversation, I echo everything what Dr. Freeman said, but it's probably the program directors, but that's again my institution. Each institution's going to do it differently.
So I would just add to this that I think this is an area where it's really, really important to speak with your school administration, because everyone's circumstance will be individualized in this aspect, where there are some who are on the side of you know, if let's say a low step score or even maybe not the strongest performance in M3 might be attributed to a significant hardship or something very difficult, they may want to highlight that. It may actually be in your MSPE because your school wants to address it. It may be directly related to your personal statement, and then your school can work with you on that. So I think this is an area where you don't just want to make the decision on your own, because your school has worked with other students in this capacity in various circumstances. This is so individualized that I just strongly encourage. And your school should already be reaching out to you in this regard in terms of how to strategize, as Dr. Freeman said. But because it's so unique and individualized, I just really encourage you all to speak with your administration on the best way to approach this, whether it's addressing it in the personal statement, having it in the MSPE, you know, bringing up in other capacities. Definitely do your due diligence in that. That's what I would want to emphasize here.
And I think one other part, apart from kind of all of the advice in terms of working with your program and your mentors, is you do want to be prepared for that though, if this is something that comes up. And so in that whole process where you're thinking about where should I address this or how do we address it, you should also, just like you would prepare for your interview and some of the more stock questions that you know that you're potentially going to hear, have some answer together for yourself that allows you to be composed. In my case, for instance, I had a problem with step one. It was a challenge for me, and it was a time when I was really not adapting well to med school curriculum. And ultimately, it was one piece actually that really helped me propel myself in terms of the curricular changes that we did at my institution, because it was taking a lot of those experiences and saying, how can we make this better for students who maybe come in with the way that I was thinking about this. And so I was able to find a spin to it that worked for my story. But I know of other people who had family hardships and things and personal hardships that came about the time when they were taking either steps or shelf exams that negatively impacted their things. And they really had to put together an answer for themselves that allowed them to still be composed when they talked about it. So even if the solution that you and your school comes up with is, you know, we'll address it in the MSPE or in your personal statement, be ready for a question and be ready with an answer that you feel comfortable giving that doesn't necessarily pry too much in terms of what you may feel uncomfortable answering.
Just the last thing, I think everybody hit the nail on the head, which is there's no universal answer to this question. There really isn't. Because I can tell you the 3 program directors that sit on my program right now, we all have different responses to this answer. The one thing that I can tell you for sure is if there is a situation that is so overwhelming where, case in point, I had one student that came and didn't do well on her step 1, but in her personal statement said she got a call the day of her step 1 or she got a call like either the day before or the day of her step 1 that her father was in a horrible car accident and had both of his legs amputated. And so she was the only one who was available to even go and get her father. So that's an over extenuating circumstance where you're like, okay, put that in your personal statement by all means. If it was like, you know, I had a migraine that day or something along those lines, listen to me. This is what I will tell everybody. If you got the interview, we already looked past that and said, we still want to see who you are as a person. Show me who you are as a person. Now, everybody has called it out and said the same thing. Always have an answer for why if somebody asks you that question. But the one thing that I tell you is, sometimes always at a point in time where somebody's overselling themselves and they're like, oh my God, I just want to get in, I just want to get in. I'm like, look, you're already here. I already want to know more about you. Tell me more about you as a person, because I already looked past that. If that helps with anybody having that kind of internal conflict.
I would agree 100% with everything. The one thing I would like to add, and feel free to bounce back or whatever. In terms of like leaves of absences and that sort of thing, I found in our committee, it's very helpful to have those addressed because committees are very creative and you don't want them to make up the reason on their own for your leave of absence. So to make sure that somewhere along the way, those sorts of things are explained is one thing I found. And let's do Jeffrey's question. So Jeffrey's question was specifically related to step 2, CK. Congratulations to y'all who don't have to do step 2 CS. That was one bright part of COVID. But since so many people had to push it back, he's asking, what are our thoughts on how to approach when to take it?
I would take it as early as possible that you can take it for multiple reasons. The first reason is you don't want to be caught trying to take step 2 CK before you have to graduate. And one of the things is we all know those dates fill up so quickly. And unless you want to go to Timbuktu to take that test, when you want to take it, try to schedule as early as possible. Now, when I say try to schedule as early as possible, if you know in your heart of hearts, the next available day is tomorrow, and you ain't studied not one thing, then maybe you should postpone that a little bit longer. However, I would definitely say don't try to wait to take it, because especially with step 2, like step 1, yes, there's more clinical things on step 2 than it is on step 1, but it still go hand in hand. And I think most of us on this panel will probably agree, the smartest I ever was probably my 4th year of medical school. And after I got into residency, a lot of that basic science knowledge went so downhill. Lord Jesus, I had to review some things for my medical students. So that's why I'm telling you, like, while you're still in that mindset, go ahead and take it. But I'll let the rest of the panelists tell.
Yeah, I would take it as soon as possible. You're pretty adjacent to your, M3 years, and so that information is going to be fresh. Definitely take it when you are ready. So I agree, do not rush it. Remember that step 2, so to start a program, and some people say even to match, but to start, you must have passed step 2. So whether that is taking it tomorrow, August 26th, or taking it in February, as long as you pass it, then you can match. At the same time, if you know that, let's say you didn't do as well as you wanted to on step 1, step 2 is an opportunity to demonstrate that you can do better on the board exam. So then you want to get that score on your application for them to review, to consider for an interview, right? So boards, yes, some of those scores can be filters. They can be, ways to, determine interviews, which, many programs are moving away from a holistic aspect. It really, for some programs is, are you going to can you take a standardized test? Can you pass your boards, right? Can you pass your PEDS boards? So if you, let's say just got 1 point above the passing score for step 1, but step 2, you definitely do much better. That may help you, right, with the committee to say, okay, this person maybe retooled their study skills, or maybe they, can definitely apprehend clinical aspects better than the basic sciences. So again, it's really tailored to you, but take it when you're ready, take it as soon as you can, because then it's another checkbox, and then you can continue to move forward, and you don't have it hanging over your head, if you don't have to.
I echo all of that. And I remember in a previous question when it was asked about, any activities or things we should do, in the meantime, and, you may not be able to, participate in community service or not. But to be honest, I mean, yes, this was a shift for all of us with this pandemic, but hopefully also this gave you extra time to study. So yes, there was a delay, in taking your step 2 CK. This should still give you ample time to study. So my hope is to all the attendees that you have prepared your plan to continue studying. So that way you can strengthen that score, which then could be a big plus, which then is definitely one checkbox done.
Yeah, I would say, and just as to close out, the one thing I think that underscores that is the preparation that we expect. Do prepare for step 2. I think sometimes this rumor goes around that, well, you've done this clinical medicine, you don't need to prepare as much for it. Step 2 scores, because of the clinical medicine, are usually higher than step 1 scores. And it can be a bit of a flag in some regard if they aren't better. And we don't know what this year is going to look like, of course. But I think what Dr. Walton just said in terms of you all have had time to prepare. There may be an expectation in some regards that those scores might be better this year. So I would really make sure you take time. Go ahead, Terry.
I was going to say, you know, this year it's all across the board. I think a lot of us are starting to be in the conversations, and so this is all of the pediatric program directors across the country. All of us are so lost as to what to do at this particular point in time that we're just kind of throwing a lot of stuff out the window and revamping a lot of things. And to be truthful, honest with you, I know a lot of people are worried. If anything, I probably would be happy if I was an applicant, because a lot of the stuff that we typically used to take for hard stock into, we're kind of like, it could be explained by COVID, it could be explained. It's just kind of like differential diagnoses, right? Like anybody comes in a rash, like, well, hell, it could be this, but it could be COVID. You know, it's just that's how a lot of us are thinking right now.
All right.
See, but then you should take advantage of that. That's how I want you all to think. I want you to take advantage of, they have no idea what they're doing, these program directors. And therefore, if you take the time to study and do what you need to do and make sure you kill it, boom, you've just surpassed odds of probably not just what you've done, but to be honest, what all other students and your peers have done, no matter race, color, creed, whatever. You see what I mean? That's what I want you to do.
We have two really good questions, so let's do this. Two of us will answer each of these. So the first one is, what do program directors or other interviewers look for in tell me about yourself questions?
Well, I guess I should take that. I should be one of the ones to take that. In terms of tell me about yourself questions, what I really want to know is, you know, not only do I want to know who you are as a future pediatrician, but I literally want to know what makes you tick. Because one of the things I would tell a lot of people is, I have to sit there in clinic with you for 3 years for at least, you know, every week for 4 hours. And we talk more about just overall things. I literally become, which most of my residents will tell you, I'm like the Papa Bear. Like they're the ones who like tell me everything, and I'm like they're great kind of confidant with a lot of stuff. That's the conversation I like to have. Most of the conversations I try to have with the residents, with applicants, are literally not about anything that has to deal with pediatrics or medicine. Like I will look for the most random thing on your application. I'm like, tell me more about that. Let's talk about it. So there was one young lady who told me she did not like, and I kid you not, she didn't like working with adolescents. Because I usually say, like, what's the one thing about pediatrics you don't look forward to? Because you can tell me all the things you want to look forward to, but not everybody loves everything. And so she said, I don't like working with adolescents. And I said, why? She said, because I was a bad adolescent when I was that age. And I dropped out of high school when I was 15. I joined a gang. I got with a 33-year-old man and blah, 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 blah. And then afterwards, I turned my life around and blah, blah, blah. My mouth was, but I tell you the God honest truth, did I not rank her higher? Because I'm like, this girl lived. I want her. She can talk to the adolescents. She doesn't know. I'm going to make her an adolescent medicine physician. But that's the type of thing that I want to know about.
Okay, I'll jump in on this one. I think what I'm looking for is the same thing. I want to hear your story. I think that is one question everyone can anticipate almost getting at least once, if not multiple times during interview season. And so I'd also like to see that you've taken the time to prepare for that one, that you're not mumbling, that it's not a 15-minute answer, that succinctly you've thought about it. I always think of this one as your elevator speech, that you are ready to answer because it's the easiest question you're gonna get. Tell me about yourself. You're the person who is the expert on that one. So that one. Our next question is, what is an interview topic that you would encourage applicants to be ready for, especially any that surprised you in your experience?
So I'm going to start because two things came to mind when I heard that question. One, I always like for you to be prepared to build on telling more about yourself beyond your personal statement. So I want you to build on it, because the personal statement was the introduction to you. Then I want you to build on that. So expound on it more. That's one. But then the second, I mean, let's face it, it's COVID. And really not just COVID, I would even speak to just the racial unrest and overall unrest in this country. I'm just very interested, and maybe if someone doesn't bring it up, you should just bring it up, in terms of how that impacted, I don't know, your studying or, you know, your overall medical school life. I just feel that's something that should come up that I bet many people are thinking about, but how does that impact you? Because I think in the future, as a future pediatrician or pediatric subspecialist, when you talk to families who are going through so many different, you know, barriers and different experiences to the access to care and just overall care for our children, that's who a patient, a caregiver, a parent's going to want to know from you. It speaks to how real you are, just how genuine and authentic you are. And so that's just my thoughts on that.
Yeah, Dr. Walton hit it on the head with the latter comment. I was slightly surprised, though greatly appreciated that, and it was mainly actually, whether it's program directors or APDs that actually asked about my thoughts about diversity and inclusion. I think just given my SNMA experience and then other activities. So I think they were able to translate, we see what you've done from this aspect. What is that going to look like in residency? There were actually a couple that were like, would you want to be on a diversity or, you know, residency recruitment committee if you came here? So I had to anticipate that for later programs and being able to answer that. I would also flip it and say those are great questions that you all can ask in your interviews. You know, if you don't have that much experience in asking them, I would you know, again, work with you guys. You're going to do mock interviews if you've been assigned. Ask your mock interviewer on how to ask that. You know, one way you might not want to say, so you guys are going to get more Black and brown people in your program. You might not want to ask it in that way. Right? Which that is what you're getting at, right? But it might be to say, you know, I've been really involved in LMSA, really involved in SNMA, and we really try to, you know, increase the pipeline of underrepresented students in medicine. And I certainly want to work on that while I'm in residency. Can you talk about some programs or initiatives that you all have in terms of diversifying your residency program, right? There's a way to ask that question. I might even word that a little bit better. But I think you guys should ask these questions and see what programs are willing to tell you. You know, so that to me is one. I think in 2020, you know, I've told students, you know, talk about health equity, if that's something that's important to you, social injustice, diversity, inclusion. Those are great, you know, words to start those discussions as well. I actually think programs are anticipating how to have those conversations with applicants as well, especially those who are underrepresented in medicine. So take the time to, you know, to really engage in that. But I actually think you guys should be, I ask those questions on every single interview. You know, and if that's something that's an area that's important to you, ask it and see how they respond. That I actually might even factor into your overall rank list is, did you, you know, they might say that's something that we're just thinking about, but we're looking for residents to come in and help us work on that, right? That's a genuine answer. That, you know, you can appreciate, or there might be some that it's evident, you can just look at the program and see that they're very diverse, but it might not be intentional. So I think that's another way that I use my rank list as well, was really seeing where the program, what their priority was on diversity and inclusion from that regard. And not just from the residents' perspective, but the faculty perspective as well. I wanted to make sure that I had, you know, opportunity for mentorship while I was in training.
So the two things that I'll kind of close this question with, to piggyback off of what Dr. Mpasi was saying, I think you know your application the best. And so in terms of something that I think you should really be ready for is thinking about how what you've done connects to the things that are going on at that program. So if you have spoken with people, residents there, graduates there, or, you know, people from your institution who went there, thinking about, hey, are there gaps where maybe I could help fill something that's going on? Or if there's something that's particularly interesting that would help fill your interests as well. So for me, a big interest in medical education. And even though I was a teacher before, I looked at what sort of training was there and really tried to find a way to bridge those two pieces together. And I think it helped at some places because it gave them this perception that not only did I know what was going on, that I could ask a question about it, but I was figuring out how to tie those pieces back to what I've done and see, was there going to be some sort of like mutual benefit? If I were to come here, is there something that I'm going to gain from this aspect of your program? Is there something that I can add? The other piece I would tell you to be ready for is be ready to answer questions about anything that's in your application. I threw a couple of things into my hobbies that I was not expecting, and I definitely had a couple of conversations about my time in Italy for study abroad, which was great, but I was just kind of not completely expecting it given other things that I had done. And one interview actually with a fellow at my current institution was a 20-minute interview about my interest in bar trivia, because he had his brother was in Chicago and knew about all the places where I played. And so we literally just talked about that for 20 minutes. And I would have never thought that that would have been the piece that someone like latches onto and has a conversation. But like you heard from everyone, I think they want to get to know you. And so everything that you put in there is a reflection of you as a person. And really just trying to make sure that you can kind of let the best you shine forward.
So Dr. Freeman, I just wanted to add to Dr. Trevino's point. I know we're at time. I just wanted to make the point again. I encourage you all to talk about this with your mock interviewer or mentors as well, is that also know that the interview is an opportunity for you all to get to know the program, right? I think many of the questions have been from the side of, how do I prepare for the interview? How do I make the best impression? And that's very important. You also, there's a reason why it's called a rank list and a match. So you want to find programs that are going to be a great fit for you as a person for your training, right? For the next 3 years, or it could even be 5 or 6 years if you go on a fellowship training. So just be mindful. Again, Dr. Trevino, that echoed for me. I actually wrote that down. I apologize it didn't come up, right? So what to be prepared for. So it is knowing your application, but knowing what you are looking for in a program. If you have any type of formation about where you see yourself going in pediatrics. So for me, I knew that I wanted a career in health policy since I was a third year. And so perhaps I'm not going to find a pediatrics program that say, here's a policy track per se, but I wanted to know what I have opportunity to engage in scholarly activity. What does that look like for residents? Would I be able to do an elective with the American Academy of Pediatrics, which my program allowed me to do? Do you have faculty that engage in policy or scholarly work that take on students? So I asked those questions because if I didn't see it at the program, then that program might not have been a good fit for me. So I think I go back to the beginning as know what are your priorities. And these questions might not be able to be asked directly in an interview, but you can ask residents that are currently at that program as well about just what are good fits for them, what they like or don't like about the program. So also use these opportunities to figure out if the program is going to be a good fit and a match for you as well. So it's bi-directional. It is bi-directional. And again, I just encourage all of you guys, take a little bit more time to talk with, one-on-one with certain people about that. I just know we can't elaborate right now, but I wanted to make that point.
I also wanted to just add, because I know you're right, we're way over time. Number one, we probably should have a part 2 to this, right? Because we need to, there's so much we can add to it. But also forget, I think you guys are probably part of SNMA, LMSA, and if you have those positions, definitely use them, because you never know who's going to ask it and actually come up in an interview. Because I'll be honest, the place where I match, this even happens in residency and fellowship. They look at everything. And if it's a superb interviewer, they are looking at your application ridiculously well. And that was the first question asked to me. That was my first question, first interview. You were vice president of SNMA. Tell me about that. Like, that was it. I just started. But to be honest, I'm impressed. That was the first thing that came up by a person I was not expecting, but I was ready. So be ready. And don't forget, you're part of some great organizations for a reason.
Last thing, Dr. Mpasi said the best thing, which is to ask to other residents, but also ask other faculty, especially if there's faculty members that are interested in, like, say, for instance, public policy or health equity. Talk with them, because you'll be surprised that faculty member may be one of those people that are your champion, especially when it comes to the committee. That's it.
All right. Well, I thank all of you. Thank you so much to our panelists for participating. Thank you so much for our attendees. I think I was told that everyone's already been paired, so everyone hopefully has their mock interview at least scheduled. I think you're supposed to be getting your CV to your mock interviewer by the 31st. So please make sure you do that. I wish you the best of luck on the trail. Wish you the best, well, I guess the virtual trail this year. If you have questions, let us know. And thank you so much for coming this evening. I wish everyone a good night.
Great. Have a great night.
Good night.
Stay safe, stay healthy.